Okay. All right. So go ahead. You have the floor, my dear.
Awesome. Good afternoon, everyone. Again, I'm Dr. Rahimi.
And I am Dr. Barclay.
We are the behavioral health providers at Magnolia Integrated Health. We're located on the first floor at ANWAN, and we have combined experiences of over 25 plus years in various settings such as psychiatric hospitals, clinics, and offices. Our services include psychological testing, medication management, individual therapy, couples therapy, behavior modification programs, grief counseling, navigating issues that your child or your children may be facing in schools, and just additional behavioral health services tailored to assist clients or patients in their wellness journey. Today, our topic is on stress management, and stress can be defined as a state of worry or emotional tension caused by a difficult situation. Now, stress is a natural human response that prompts us to address the challenges and threats in our everyday lives. Now, everyone experiences, stress to a certain degree. Dr. Barclay?
Yes, so we've introduced the concept of stress, and again, stress, like Dr. Rahimi just mentioned, is a natural human response. However, there's 3 types of stress that we get a little concerned about. And the first is what we call acute stress. Now, acute stress is usually brief. It's the most common one, the most common and most frequent presentation. And it's most often caused by, say, a type of reactive thinking or negative thought patterns that predominate about situations or events that we recently experienced, a feeling not in control, or worrying about an upcoming situation or event or demand in the future. The other form of stress that's kind of in the middle is called it's the episodic acute stress. And this form is a form of negative stress that causes people to have what we call intense reactions when they're in situations, again, where there's uncertainty or they feel out of control. This type of stress is caused by many different things. And, the PowerPoint that's gonna follow will go more in depth with Dr. Christie. But including a few of the things that can lead to this episodic acute stress is maybe some form of financial instability, job insecurity, or a form of family dysfunction that may occur occasionally. Episodic acute stress leads to some pronounced health issues such as cardiovascular, like high blood pressure, or heart disease, or irritable bowel disease. So those are some of the things that high anxiety states may contribute to. The last form of stress is what we call chronic stress. Chronic stress, this is kind of the most harmful type of stress because it's like your body doesn't really take a break, and it's just constant. And if it's left untreated for long periods of time, it can significantly and often cause to irreversible types of physical health and deterioration in your mental state. Now, some of the examples of chronic stress would be long-term poverty, the financial instability that lasts for a long time, like, for example, homelessness that lasts for many, many years, or a repeated abuse in certain forms can lead to that as well, or unemployment that lasts for a long time. So substance abuse, that has not been addressed is another form of chronic type of stress that may impact, your physical condition as well as the family structure. Dr. Ward is, going to provide a little bit more in-depth presentation on the stress, the management of that. I just want to say that we are at Magnolia, we are actively involved in managing these conditions. I handle a lot of the medication management, and Dr. Rahimi handles a lot of the brief sessions or long-term sessions.
Thank you. And now we will turn it over to Dr. Ward. Dr. Ward, you're on mute.
Good. Okay. Yeah, who's under some stress management right now just because I can't them. So I'm having just some small technical difficulties. But as the doctors have just really pointed out, we are living in a stressful environment. And as a consequence of the stress that we have, it's taking a toll on us mentally, physically, and psychologically. And so I always say that mostly women, I see a large variety of women in the practice, are having this superwoman type of syndrome. And it's because they're managing a lot of aspects of who they are and the titles and the roles that they play in people's lives. And the result of that stress and not being properly managed can lead to endocrine disruptors, autoimmune disorders, and psychological dis-ease. And so I implore you, while you're dealing with the consequence of your day-to-day lives and careers, to definitely seek out some counseling, therapy, having people to help you work through the stressors in your life. As I work through the stressor of getting into the system. So just hold tight for me as we are almost there. Also, ladies, we've come upon the precipice of the 12 weeks. And next week we'll be final in doing our final weight assessments and health checks as a resultant of that. Hold on. We're almost there, y'all. Any questions, ladies, while I'm accessing the system? Okay.
That's right. We go operate in the affirmative.
Listen, that's always how we do things. If y'all know me, y'all know we are always operating in the affirmative. I appreciate your patience with me today. And so there's a wonderful presentation of slides that we have available for you as it relates to stress management. And just let me say, while we're getting those things together, the presentation is about cortisol and stress hormones. So let me just go through some physiology. As a just suprarenal, meaning just above your kidneys, is an organ system, endocrine organ system, known as your adrenals. Your adrenals are responsible for secreting cortisol. It is as a consequence of fight or flight. It acts with the full endocrine system and your pituitary glands to help manage hormonal balances. So as a consequence of stress, what happens is the adrenals secrete this cortisol. And some of you are like, okay, well, great, it's secreting the hormone. Well, cortisol is responsible for a lot of the things that we, that can have a negative impact on the body, okay? So when we're under stress and we are fighting the proverbial bear and we're running in the woods, we need all of that energy. We need to get in fight or flight. We need to go into a place where we can really do what we need to do to survive. So it's a survival mode. But we are all living this American life, chasing what can be the American dream, and it comes with a level of stress. And let me just explain that stress is what your body deems it. Oftentimes we come in, you may see myself or Dr. Christie, and you're like, well, Doc, we ask you about your stress and you're like, I'm not stressed. I don't have a stressful job. Oh no, I don't feel any stress. It is not what you interpret as stress. It is what your body interprets as stress. Okay. Some of us readily know that we are stressed out. That can manifest in anxieties. It can manifest in a host of other ways. Heart palpitations, sweating, um, cravings of sugar, cravings of salt. All of those are manifestations of the stress that we can feel. Stephanie, are we there yet? Okay. And so these stress hormones can lead to situations like insulin resistance, right? And that just means that insulin, your body is basically rejecting the insulin, and it's not allowing the glucose to be utilized in the cells appropriately. That can happen as a resultant of high stress and high cortisol levels. Weight gain. So many of you are saying, hey, doc, you know, I have been on protocol. I've been on my diet. I have been where I need to be. Why is it that I continuously gain weight? Well, cortisol may be playing a role in that. We had prior conversations about getting hormone levels checked and the like. Cortisol is a culprit. It means that the body is under stress and it is holding on or creating an environment where weight gain can be imminent as well. Okay. Miss Stephanie, she's still working on it. And so the cortisol levels in the body can be mitigated by a variety of different things, right? So how do we respond to these stress hormones? Well, one of the things that we can do is exercise, right? Dr. Christie talks about exercising and balancing in the body. And if you've been on the 12 weeks of wellness and, we're going through the 12 weeks and walking, and your cardiovascular is a great way to offset some of the stress hormones. In addition to that, we have adaptogenic types of herbs that allow us to do that. One of the most common adaptogenic herbs that many of you all, and I think one of our 12 weeks of wellness members spoke about was ashwagandha. So those adaptogens allow us to go into the body, and it doesn't do anything like specifically. What it does is it goes in where it needs to create general overall wellness in the body. So ashwagandha.
Excuse me, Dr. Ward, give me 1 second. I gotta get with Dr. Christie to give me access to let you share.
Okay, wonderful. And so those are some of the things that are there. Ashwagandha, all of the ginsengs. There are several ginsengs. There is Eleuthero, which is a Siberian type of ginseng. There's American ginseng. There's Chinese ginseng. And of course, there is a Ayurvedic form of ginseng in a variety of ways. So all of those adaptogens go in, and we'll go into the physiology of it in a moment, to help us brace the body for stressors. And so typically it's about 500 milligrams several times a day of a ginseng, which would be either Eleuthero, American ginseng. There are some Chinese forms of ginsengs as well, and ashwagandha that act to help you in stress mitigation. What we also know is that there's something that we have in the office known as DHEA. What is DHEA for? Well, DHEA is secreted by your adrenals, and supplementing with the DHEA will allow your body to reduce cortisol levels. So this is another way to chemically allow the body to have a favorable or a less invasive response to stress. Okay, and so we typically recommend that DHEA for people over the age of 35. And many of you may say, well, 35, doc, is young in this. Well, yeah, we start to see signs of stress. There are chemical stressors that you are inundated with, environmental stressors, and the stressors of, again, your careers and your titles and your roles in your family life as well. Okay. And so those are important adaptogens that you need to add to your regimen of wellness. Any questions?
Yes, quick question. So most people know that when you're happy or your brain is stimulated for happiness, you're releasing dopamine. What chemical is released by the brain when you're experiencing stressful situations?
It's more so the body is gonna secrete cortisol. Cortisol is the response to that stress, that fight or flight. Now, there is a connection, and hopefully that slide will be available soon, to your gut brain balance. Okay, so your body has a variety of dopamine and serotonin receptors in the gut, right? And so sometimes as we go through stress, we are having a quote visceral reaction. Sometimes you can go through things and your gut kind of tells you what's going on. That's because you're having neurotransmitters that are secreted as a result of your brain and in your gut have the reaction for you. So although we're looking at cortisol as the primary stress hormone, neurotransmitters can be directly affected by the stress that we have. There are things that we can use, such as the St. John wort, in ways that are helpful in balancing out serotonin, dopamine levels, and the like. Making sure that your gut health is optimum are also a variety of ways that will facilitate wellness in the brain. Serotonin, dopamine, acetylcholine, GABA, all of the neurotransmitters that create neural relaxation. Did that answer your question?
Thank you. Absolutely, and I took note.
Okay, wonderful. And so we have secreting every day the chemistries of the brain that are altered by day-to-day functions. And so many of us, when we first started the program, did the core restore. We do that for anti-inflammation, but to also reset the receptors that are germane to your neurotransmitters as well. Okay, so that acts as a detox. It resets things from your gut-brain barrier to allow dopamine and serotonin to be readily available for you.
And what's the name of that again?
Core Restore. That's in the beginning of 12 weeks of wellness, we put everybody on the Core Restore detox. And part of what that does is that detoxifies the system, but as a result of detoxifying your gut, we are able to reset neurotransmitters such that dopamine and serotonin work more effectively in the body, because you're getting more dopamine release in your gut than you do your brain. That is why the gut is called the second brain. That is why under stressful situations, you can have very visceral gut-like reactions, right? As a consequence to having stress, you can have anxiety that starts in your gut. And you can say, hey, doc, I get stressed out and I have to go to the bathroom, or I'm getting this rush, or I get stressed out and I get constipated. All of those are germane to the gut brain balance.
So how do you determine if you have any of these stressors?
Oh, well, I can tell you today you have some stressors. Yeah, the stressors, and let's just go over it. You are being inundated with stressors on a daily basis, right? It may not be stressors as you identify them, but if you go out and walk in the air and there's a pollutant, that becomes a stressor to the body, right?
Oh,
It is the things that create stress that the body deems, right?
It comes with, it's not, there's no drugs in here, it's just 3% nicotine.
Okay. Stephanie, can you mute for me, please? Thank you. And so it's environmental stressors, it's endocrine disruptors, it can be psychological stressors. It is anything that the body has deemed unfavorable that can act as a stressor. There are food stressors, there are allergens that stress you. And so you may not feel the stress physiologically. That does not mean that you're not being inundated with it.
so how do you know if the
Some stressors you can readily identify, others you may not be able to.
so how do you know if you need to take something or not?
Well, I would recommend that you take something to help the body adapt. So in situations where you don't have appropriate amounts of sleep or water, all of those things become stressors to the body. So we want to manage that stress by figuring out what is offending the body and what is creating the stress. So if there are environmental factors and food-like stressors, then we detox the body, right, as a way to manage that stress. If there is a stress on the job, then there are ways that we maybe can operate in our scheduling that will allow us to reduce or minimize stress. As the ancestors would say, stress will kill you faster than anything else, to which a lot of us have found to be very true. And so some of the stressors we know we can readily identify, but having a good stress management plan, exercise, massage, eating low inflammatory types of diets, meditation, prayer, all of those contribute to how we manage our stress. Creating an environment where you're edifying and fortifying self-care. Does that help you?
So do you take a test to find out what our stresses are and what we need to do, or what?
There are some tests that will test different levels, cortisol levels, hormone panels can be great identifiers to stress as well. There are biometric scans and the like that we can do. There are many tests that we can do, neurological testing functions that we can do as well. So we can do those, we can do tests in office.
Okay.
Okay. Okay, so allostasis, this is the ability to, you all can hear me well?
Mm-hmm.
Okay, so this is your ability to change, right? You have to be able to have a favorable response to stress. You're gonna be inundated with it. That is a consequence of living this life. It is something that is a must. I mean, you're gonna have to be able to adapt. Our allostatic load has more to do with the wear and tear of this chronic stress that we have. Okay, and Ms. Davis, here we go.
Yes.
Environmental stressors, major life events, trauma, abuse, our behaviors and our responses, in lieu of our fight or flight. Create a physiological response. Okay, it just does. Whether you feel it or not, it's still creating a response. Here's what we do know, is that there is an economic impact to the stress. People go out on stress leave, which is, sometimes necessary. People are having to utilize some prescriptive drugs as a way to cope with stress, calling off work, and the like are all contributing to stress. One of the bigger stresses, too, that I did not mention is economic stress. Many people, as a consequence of the economy changing, undergo stress. Okay. The adrenal glands, and as I stated before, they are what we call suprarenal. So they're just right above the kidneys. Some of you, when I'm muscle testing, I'll test your adrenals to kind of see where they are, if they're overactive, underactive. They sit right above your kidneys, and they create these pathways for cortisol. Okay. So what does cortisol do? Well, we know that it's produced by the adrenal glands. It regulates protein, carbohydrate, lipid, and all of our nucleic acid metabolism. It can elevate your blood sugar and your blood pressure as a consequence of fight or flight. It can create anti-inflammation, which will suppress something called your cytokine. Some people can have cytokine storms that lead to inflammation. It decreases antibody production. It suppresses the release of growth hormone. This is important because as the body rests, we secrete these growth hormones to repair. Okay. So DHEA, these are all precursors to our sex hormones, right? They directly bind to receptors, and that would be neurotransmitter types of receptors in the brain and throughout the body. More specifically, the NMDA and the GABA receptors, okay? Those are responsible for focus, organization, and the like as it relates to the brain. DHEA also lowers our triglycerides. It maintains our tissue health and integrity, promotes bone growth, and improves our sensitivity to insulin. Okay. These charts are just saying how we manage the stress in a cycle. Okay. So the takeaway from here is that the wear and the tear of your body is resulting over chronic activity or inactivity of these systems, your endocrine systems in the body. Okay, I'm gonna move a little bit faster here. So adrenal fatigue is a thing. And so it can lead to severe and chronic disease, right? Panic disorders, obsessive and compulsive types of behavior, as it has a direct correlation with neurotransmitters, as I stated before, like GABA. There can be issues with malnutrition, diabetes, and obesity. Okay. Okay. So we can characterize our stressors by the duration, how long it lasts, the severity, how impactful it is on our lives, and our exposure to chronic stressors. Some of this may be dependent upon many things, genetics. We do understand that women have a lot of stressors. A lot of that is because we multitask and we are responsible for a lot of different aspects, okay? So our responses to stress are heavily dependent on prenatal stress, our childhood stress, how we view ourselves, and how we hold ourselves in high or low esteem. Those are factors in how we view stress and stress function. Okay. And there again, this adrenal dysfunction is going to be impacted by your endocrine system, your cardiovascular system, your reproductive system, your peripheral nervous system, and your immune health and physiology. Okay. These stressors can increase issues of autoimmunity. Okay. It can increase issues of emotional and psychological dis-ease. And so having inadequate immune systems as a result of this cortisol will increase inflammation and create antibodies. Those creations of antibodies can result in autoimmune dysfunction. Okay. So this is our catecholamine cortisol balance. We can have a decrease in what's called catecholamines and increase our cortisol. I have sheets on how to reduce catecholamines in the body, which I'll probably drop after this. These catecholamines kind of go into the body and it creates a loop. So we can increase or have an increased in cortisol based off of how our body synthesizes and treats catecholamines. And then your body goes into sympathetic dominance, which is our fight or flight syndrome. Okay. So prolonged issues of hypercortisolism are issues of memory that is stemmed in your hippocampus, depression, PTSD, even temperature regulation are all in your hypothalamus. Those dysfunctions can be greatly affected by high cortisol levels. The amygdala, which is responsible for emotional stability and the like, are also highly responsive to high levels of cortisol. Okay, and our prefrontal cortex, which is where we make most of our multitasking, executive, high-level decisions, are quite sensitive. So I'm going to move down just for the sake of time to the things that we can do to help mitigate that. Okay. This is also brain, gut, stress, immune balance as it relates to that. And these slides will be available online as well. I do realize that we were having some stressors with technology today. Okay. One of the also tests that we do run in office is heart rate variability that lets you know your stress response. You have a printout of what that is in those heart rate variability studies, and we do them in office. Okay. All right. Any questions, ladies? Gents?
Does it take a blood test to find out your stressors?
No, it's not a blood, it's not a blood test.
So how do we find
It's
out?
more of a scan. So your heart rate variability, we do in office, it will be a scan and it's not blood related. Your cortisol levels and certain hormone panels will be blood and urine related. Okay, and we can schedule those tests in office.
Okay,
Okay.
yes.
Getting down to the ways that we help with the stress, herbs like magnesium. We have a fabulous product that we use with magnesium in it. Magnesium controls about 400 enzymatic processes. It can be the difference between heart palpitations and a restful night's sleep. The type of magnesium that we advise you to have in the office has approximately 4 in there, and that would be the citrate, magnesium citrate, glycinate, taurate, malate. And in certain formulas, we will also have magnesium threonate and oronate. And so our magnesium supplementation will help your body drastically reduce stress. Philodendron, magnolia, all of these are nervines. These are things that we can take to help our nervous system. And philodendron has been shown to normalize high cortisol levels. Magnolia bark acts almost as a relaxant in the body. There's also L-theanine. If you like green tea and you feel the benefits of green tea, even from a metabolic standpoint, it's a wonderful thing to have, but it does have an anti-anxiety effect. It tastes great, and it does have theanine in it, which is bioavailable to you. That will also help increase GABA and glutamic acid. All of those are neurotransmitters. So have a cup of green tea, ladies. You can also supplement with L-theanine, and the dosage, typically, I would either consult with myself or Dr. Christie about dosing, because it can be bio-individual. But typically the dosage is around 50 to 200 milligrams, 2 to 4 times a day. Plant sterols, pine extract, it's sold readily on the market. And it definitely has an effect on cortisol levels. Okay. Is there a question? Any questions?
I have a question. On one of the slides, there was the cortisol, and then it said DHEA.
Yes.
So would it be, does the DHEA supplement help to level off that cortisol?
Yes. Yes.
It does.
It has a direct effect on it. Absolutely.
Okay.
I think someone's phone needs to be muted. Okay. Yes, it has a direct effect. So when we give the DHEA, and it's been highly recommended that you all, anybody over 30, take DHEA, 5 milligrams for women, maybe up to 20, 25 for men. It is for this reason as well, okay? Because it aids in balancing out those cortisol levels, and it helps to fortify an already fatigued adrenal system. Is that clear? So yes, the answer is yes, DHEA helps us in reducing our cortisol levels.
Yes, thank you.
Mm-hmm. And so these are the ginsengs. So Erythro, Siberian ginseng, it's a popular adaptogen. It can be used in aiding in normalizing your blood pressure, insomnia, Alzheimer's, just to name a few, chronic fatigue, fibromyalgia, amongst many other viral types of pathology. It is a wonderful adaptogenic. Just as we know a lot about ashwagandha, Elithro is a pretty good one too. It can also increase natural killer cells as well. So that is the Siberian form of ginseng, okay? And these are peer-reviewed studies that tell us what we have known in the naturopathic world for some time. So I'm just gonna go up. Rhodiola. Rhodiola is a wonderful adaptogen as well. It will increase your stamina, mood. I use it a lot in sexual dysfunctions. It's helpful in menopause. It's a wonderful.
Only the taco salad.
It's wonderful in mood enhancements, and it will help to build you as well. So we have rhodiola.
No, you can get the regular one.
I think someone needs to mute. It has over 30 compounds, bioflavonoids that are available to the body, okay? And these are the forms of rhodiola. This is ashwagandha that many of us have heard about. People are taking it just as an adaptogen for stress, but it's helpful also in arthritis and anxiety. Fibromyalgia still comes up. It does have an effect similar to Panax ginseng, which is a more specific type of ginseng, but it's pretty safe as an adaptogen, just as an overall wellness tonic, okay? It's been known to reduce oxidative types of stress as well, okay? And typically it's about 5 milligrams. Okay. NAD.
You went blank. We couldn't hear what you were saying.
Oh, I'm sorry. I'm moving on to NAD.
Before NAD, that you were ending about the rhodiola.
Oh, okay. I'm sorry. Ashwagandha. We have all kind of heard the effects of ashwagandha. It's a great adaptogen. It's used in a variety of arthritises, just an overall helpful agent to oxidative stressors of the body, okay? And typically ashwagandha is taken in about 5 milligrams twice a day. I would yield to myself or Dr. Christie to dose you appropriately when taking the products. And many people can go, you can do Elithro for a certain period of time, then go to ashwagandha. So you don't have to take one of the adaptogen all the time. You can vary your adaptogenic source, okay? Because they all work on the body in a different way. They have a different type of plant energy. NAD, we've spoken about NAD and how it's so powerful in your brain food. And so many people are on NAD, okay? All right, and so these are laboratory values of how DHEA helps to increase or DHEA helps to decrease cortisol in the saliva. Okay. Okay. All right, ladies, any questions, any comments, any concerns?
I
No?
do have questions, but I'll ask you tomorrow.
Okay, I'll be
If
happy
that's
to
okay.
answer them tomorrow.
Okay.
Absolutely. Okay,
Thank you.
so ladies, go on about your day, managing your stress effectively with some of those herbs, massage, meditation, prayer. All of those things will be wonderful adjuncts to stress for the day, stress in 12 weeks, and stress for a lifetime. You all have a great, blessed, and wonderful day. Any other questions I can answer for you?
One more, doctor. You talked about Core Restore Detox that everyone started on week 1. Was there any other products that you have at ANWAN that help with stress, or are there any of the ingredients that you discussed today in your daily vitamins that you all have at ANWAN as well?
Yes. So in our women's vitamin, there are adaptogens that are that have been proven to help. So you can kind of take it all in one. We have a muscle relaxing formulation there, full of all of the magnesiums that are available. We also have a mood formula that will aid the body in reduction of stress and cortisol levels as well. We have DHEA that's there for you, to which most patients have been recommended that supplement over the age of 30. We just know that it just helps remedy these issues of hyperadrenalism. We have glucose support, which will help us with the sensitivities that happen as a resultant of high cortisol levels that create insulin resistance.
Thank you for that. I appreciate it. I did come in and get the daily vitamins for 50 plus. I'm going on 43, but it was suggested to go ahead and grab the one for 50 plus. I've been taking it for about a month. I stopped taking the GNC vitamins, which were women's energy and metabolism. But I did notice that when I switched over to the ANWAN, I just didn't feel, I guess you could say I felt a little depressed. And so today was the first day that I decided to switch back over to the GNC just to see what would happen. And for the last, few hours this morning, and this afternoon, I don't know, I feel like dopamine's been released. So I don't know if my body has just, I don't want to say gotten used to the GNC, but I did notice that my mood drastically changed when I stopped taking the GNC and went to the ANWAN. So I probably will have to supplement some of the mood support with the 50 plus daily vitamins, because there's just something there in the GNC that I don't know what it is in there. But I did stop taking them at first because there's a little warning sign on the bottle that says could cause cancer. And I was like, oh, well, that kind of sucks coming from GNC. So I stopped taking them and I started with the ANWAN 50 plus. So I'm definitely going to have to come in and get the Core Restore Detox and probably some mood stimulation supplements.
Yes, I would truly recommend that. And, we have scans, antioxidant scans in office that are available to you to test antioxidant levels as well. Here's the thing. I don't sanction companies who sell vitamins per se, right? Because there may be issues of quality control. This is what I do know, is that oftentimes if I take an x-ray, I can see some of the vitamins of commercial places kind of out there. Many of them have been under litigation for selling, supplementation that's not bioavailable to the body. Oftentimes in an adaptogenic setting, you don't feel like, whoa, you don't get a rush of something. It works in the background, okay? And so those background responses, although you may not initially feel it, it's working towards making sure that your body is in proper alignment and that oxidative stress and free radicals are being mitigated as a result. Okay, so I sanction certain ones because I don't see them on x-ray and I know that they are bioavailable. So we can always look at adjuncts to protocol, and mood support would be an excellent addition. If the vitamin that you have taken at the local Walmart does not break down in the system, you haven't really taken anything. So this is what we know is that, at ANWAN, we have what is bioavailable, what breaks down in the body such that your body can utilize it effectively. Okay, any other questions, comments, or concerns? Okay, ladies, we are not completely finished with the 12 weeks. We have until Sunday. So make a mad push. And I'm sure that we will send a link out just to get your final tallies and numbers, right? I'm looking at you all and I can tell great differences in you. And so I look forward to you all seeing you next week, hearing all the great success stories of where you are at now. Have a blessed and wonderful day that is stress-free. And if it's not stress-free, let's manage our stress appropriately, okay?
All right, thank you,
Okay.
Doc.
Be well.
Thank you, Dr. Ward.
Uh-huh.
See you tomorrow.
All righty.